Hi, good morning, good afternoon, and good evening from wherever you are listening. My name is Danjuma Adda. I am president of the World Hepatitis Alliance. Today, July 28th, marks the World Hepatitis Day, and I want to congratulate you and everyone that is marking this day to increase awareness about hepatitis and to raise concerns that hepatitis is still neglected across the world. By the time I'm done speaking with you, one person would have died every 30 seconds from hepatitis-related ailment. Why should we, even in the 21st century, with the medical breakthrough of an effective vaccine for hepatitis B and an effective treatment for hepatitis B also, and a cure for hepatitis C, why would people still die and still suffer endlessly from this disease that has this treatment and has a cure? It is totally unacceptable. Children are still born across the world without access to the hepatitis B birth dose vaccine. Yet, this vaccine costs only 20 cents. It's therefore unimaginable why partners like Gavi will delay support for the availability of this birth dose vaccine for children that will be born and be administered this birth dose vaccine, so as to have a new generation of children without hepatitis. This is unacceptable. We call on Gavi and other partners to make hepatitis B birth dose vaccine available for children across the world. The delay is costing millions of children getting infected with hepatitis B, and this is totally unacceptable. People still today lack access to hepatitis B care. In most middle and lower middle income countries, people still pay out of pocket. People living in hepatitis B still pay out of pocket to access care, where it is available in centralized hospitals in urban areas, leaving majority of people in the local communities and rural urban area or local areas without access to the care that they need. Hepatitis C treatment is still unaffordable to majority of patients living with hepatitis C. Stigma and discrimination have denied people living with hepatitis access to visas, travels, job opportunities, and in some instances, even relationships and social contacts. All of these are avoidable if only we can increase awareness about hepatitis, if only governments and policy makers can increase financing and investment into hepatitis elimination to ensure that the out-of-pocket cost is taken off so that people needlessly don't need to suffer from this disease. I'll end by quoting my mentor and the founder of World Hepatitis Alliance, that hepatitis is like a neglected child in the home. While the older siblings, like malaria, HIV, tuberculosis, are getting new branded clothes, hepatitis is still wearing the tattered dresses, the torn clothes, and this is not fair. We're not asking for new branded clothes. We're just asking to share what our siblings, the HIV and malaria are wearing. We're just asking for equitable access to care for people living with hepatitis. We're just asking to be treated with dignity as people living with hepatitis. We're just asking that populations living with hepatitis should not be left behind in health financing, in prioritizing health financing and budget across the world. It is time to act. And it is time for governments to make hepatitis elimination a priority to stop hepatitis and to stop the needless suffering of people around the world. As we mark this very day, I want to say hepatitis can't wait. And thank you so much for joining us to mark this global day. Thank you and do have a nice day.